Hello everyone, we are in the company of Valentina and little Ambrose, 1.5 months old. Let's try together to see some useful breastfeeding positions. Ambrose now really wants to suck at mommy's breast. He is telling us this in every way. Let's try starting from the classic position, which is the cradle hold. So Ambrose finally gets to mommy's breast. Let's try to see together how to guide the attachment. It might be very helpful that with one hand we hold the breast, and with the other hand we bring Ambrose closer to the right position, so a little bit lower than the nipple. The chin pivots, we bring him close, hold him close, and wait for him to open his mouth wide. Watch how he goes for the breast. In this way we try to offer Ambrose the breast with all useful attention. You see that we do not hold him at the level of the areola, but a little bit further back, because Ambrose has his mother's whole areola in his mouth in such a way as to bring the nipple to the bottom. During the first suctions, we can help him when he is tiny or when he escapes by holding the breast ourselves. In this way, we ensure that, like a sandwich entering the mouth, the baby has a deep latch. Instead, when we feel that his sucking is good and we ask Valentina, she really feels the perception of pressure. She feels that he is sucking, that he is exerting a vacuum without having pain. Okay? We slowly try to let go. When we leave mommy's breast, be careful to keep the puppy firmly attached to us. Let's see how Valentina brought Ambrose to the breast by keeping his body exactly against her belly. Between the two of them, sorry I'm bothering you, not even one of my hands goes through. This means that the baby is perfectly leaning against mom's body. First advice we give when we feel that it is attached well, when we have no pain, and from your face it seems to me that we have no pain. We fix mommy's position, so we pull our shoulders down. Maybe we lean back if we are at home and surround ourselves with pillows, because it is important that we can be comfortable for as long as the feeding lasts. Let's observe what Ambrose looks like at the breast. See how Ambrose's little head is in extension, that is, he takes mommy's breast looking up. He should not suckle with his head flexed forward, because that is a position that would not facilitate the opening of his mouth. We listen to the sounds he makes when he is attached to the breast. Listen to him breathing. There are no pops. Things of this kind that would make us think he is passing air, so the grip is not correct and he gives a completely regular breath. We observe the attack. First, we trust Valentina's feelings that she has no pain. So this is the most important information to start with. Then we go to see what the puppy's attachment to the breast. Let's see that. Ambrose, hello love. Ambrose is now doing a beautiful, nourishing sucking. He has a deep, steady and rapid rhythm with each sucking, swallowing and breathing, swallowing and breathing. This is typical when the anate is hungry or is at the beginning of feeding. So first part, more ravenous we would say, okay? Let's observe what his mouth looks like. Let's see how he has his upper lip and lower lip completely open. Even Ambrose's chin we don't see. There is completely sunken on the breast. The chin acts as a pivot. So when we bring our puppy to the breast, chin propped up so that he can open his mouth completely. Another very important thing, observe Ambrose's temporomandibular joint as he sucks. See how it all moves down to the ear. Basically, you see the ear moving. Do you see this work, Valentina? It makes us say that the sucking that Ambrose is practicing now is deep sucking, effective sucking. That is, it works very well. He's extracting all the milk he has to extract, okay? Just two cautions about the position with which we bring the baby to the breast. First thing we said, belly to belly, meaning nice and nice on you. You see, Valentina has already experienced 1 month into breastfeeding, supporting her little head from the root of her neck. So this part, the occiput, I leave it free because the baby has to be free to do this, to decide when to attach and when to detach, okay? But because he is tiny, we have to support the head, we support the root of the neck, and that brings his torso closer to you. Let's make sure that the baby does not find himself closing in on himself, hunching over, as he could do in typical fetal position, usually in the first month, okay? Then you see how Ambrose is perfectly on axis, that is axis, head, shoulders, pelvis, straight. He's not sucking like that, okay? That is, he doesn't have his tummy looking up and his head turned toward the breast, because in this way, clearly swallowing can be difficult, as if we would be eating like this, okay? It's helpful that it's completely on axis. Well, this is the position that most frequently you will be familiar with from the beginning, the cradle position. Another very important thing, observe what the breast looks like when the puppy comes off. You see that Valentina's breast is rosy, the nipple is not elongated, no strange shapes, no strange coloring. That means Ambrose had attached well. Instead, let's try to look at a new position, which for so many of you will be an almost unfamiliar thing, which is the biological nurturing position, that is the sitting position. Why is it very useful? Because in the biological nurturing position, the baby latches on much more easily with a deep attachment. So when we have those situations of attachment pain, of raggedies, or babies who have some contractures, who don't open their mouths well, obviously along with osteopathic work, we can try to insert an attachment, a breast position that facilitates a deep attachment. That is, that attachment in which the baby's mouth is open as much as possible and the mother's nipple is sent down so that it is stimulated as little as possible. It also increases stimulation, which means that milk drainage tends to be greater. What care should be taken when we have a seated attachment? The baby can be attached in the sitting position from day one, so it does not need to be a big baby. Of course, the attentions to be taken are different. We sit him, mom sitting, on one of the two legs in front of the breast we are going to offer. So we do a position change. Then the little puppy tells us how he prefers to be placed. If he is a little one who is still in the fetal position, we keep his little legs frog-like, so nice and flexed. If he's a little older who wants to stretch them out, he'll sit straddling, so like this, leggy this way, leggy that way, as we feel he's most comfortable. Let's bring your belly closer to his belly again, so that there is no space between you. He is sitting this way. You see how he is sitting. And so it also facilitates digestion and the passage of milk, especially in those cases of frequent regurgitation. This way, he will be facing the breast. With one hand, we always support the root of the neck, so we are going to support him back here. With the other hand, we go for the breast, again, just slightly back from the areola. The attentions to be kept are exactly those of the cradle position. So we bring Ambrose close, chin pivots, mother's nipple looks at the nose, because in doing so, we wait for Ambrose to open his mouth wide. If he feels like attaching himself, little love, how good you are, what a job you do. Let's look again at the sucking movement that Ambrose is making, which is a movement that involves the whole joint all the way to the ear. In this position, I have to support the breast. So with your left hand, come and support. Very good, like this. And with your other hand, support his neck. The important thing is that Ambrose doesn't slip back, but we keep him well close to us. Two cautions. The chin in this position is perforce sunken into the breast. So basically, we don't even see the chin anymore. The mouth is definitely wide open. The little nose is free. Observe how he points it upward, okay? This position could also be made into a semi-prone position for the mother, so maybe even a little more comfortable. I lie down more and more, bed, couch, until I am semi-sitting and the puppy is prone, sucking on me, so he sucks on his stomach basically. The important thing is that the breast does not slip away from us. That is, he must not look down at the nipple Otherwise, even if he takes well, it will slip away from his mouth, but he must always look in the direction of his mouth. Also observe his posture. The little head is hyperextended, the little nose is free, the chin sunken. This, guys, is the perfect attachment of the position in biological nurturing that you can use right away as soon as the puppy is born, and especially if you have discomfort at attachment, problems with rugades or babies not growing so well, because in this position we promote deep attachment and thus good breast drainage. Another position that is useful to know about breast attachment is the rugby hold, which is a bit of an odd position. Basically, we hold the baby like a rugby ball, meaning he is no longer in front of us with his body, but he will be sideways. Right, Ambrose? He gives us the okay. Why is it useful to know the rugby position as well? Because especially when we may have attachment problems, discomfort problems, rugades problems, changing position often means going to stimulate different points of the breast and also going to empty the whole mammary gland properly. So avoid problems of engorgement or failure to drain the breast. In the rugby position, we basically have to turn our pup around. He will find the breast no longer in front of him, but he will find it in front of him from the opposite perspective. We try to position the puppy on our side. So Valentina comes a little bit further forward because he is long. He is already a big puppy. And we have him looking with his belly at mom's belly, mom's side. So he rotates. In this case, we see that part of his body is behind mom's body. We have to give him room. We slide him a little more back. Again, we approach him with our chin and the nipple points to his little nose. We wait for him to gape and feel like it when he opens his mouth wide. There you go, love. Stop there, that you got on the tip. When he feels like it, there it is. Then this movement that Ambrose did, super. When he's in the mood and he opens his mouth wide open, that's when we bring him closer to the breast. Okay, we can stay for a few more moments holding the breast, or if we feel like it's taken well, that it doesn't hurt and doesn't slip at the tip, we slowly try to let go. Mom's hand slips to hold the root of his neck. Very good. Support the little head well because he doesn't run away back. Okay? In this position, always be careful that the breast tissue is not stretched. I mean, we must not see this because in the long run, a stretched tissue then stretches if it inflames and bothers us, but as close as possible so that it gives us more space. Very good, this. In the rugby hold, we see how Ambrose goes to stimulate exactly the opposite side of the breast where he rests his nose and chin, so he empties these two areas of the breast more. If we are interested in emptying that area because we feel hard areas because we have the doubt of engorgement, we can change the location, okay? So in addition to attachment, remember that in breastfeeding it is very important to listening to the breast. We look at it in the mirror, touch it, feel it, try to nurse it basically. Even in this position, especially if it's a new position that we're not used to being with, it's important for mom to feel comfortable. So we realign our shoulders, okay? We put a nice pile of pillows on it, and we can also have a pillow down here supporting mom's arm. Great. We see how during the feeding, most of the areola is inside Ambrose's mouth, so he definitely spread it wide open and sent the nipple to the bottom, to the back of his mouth. He doesn't take it at the tip because the areola we hardly see anymore. Okay? Let's now look at a new position, a position that mothers like so much right after childbirth, especially if they have had a cesarean section. It is a position that could save our nights, that is breastfeeding in a lying position, semi-flexed legs. It could be even more helpful to put a pillow between the knees to reduce the pressure. and the feeling of pulling at the hips or even the upper leg leaning toward the bed. In this position, we are certainly in complete relaxation, complete well-being. We have seen how to position mom correctly. How do we position the baby now? Once again, when he attaches to mommy's breast, his belly has to look at mommy's belly, so he will not be looking skyward, but we rotate him and place ourselves on his side, belly against belly. So once again, between you and him, nothing passes. He here sees wonderful lights, so he is super attracted. We turn Ambrose over and again put him with his head next to mother's breast, a little lower. He is already a super expert with an independent attachment. You see how in attaching to the breast, his head is still hyperextending. He finds mommy's breast not in front but upward, so he is a little lower than the breast of the mom. When he is attached, if we feel that he has taken it well and has no pain, this hand slips, leaves the breast and holds Ambrose's trunk and neck. Always watch the little nose, so we release it to him, making him look up. When he looks up, the little nose is clear. Once again, we see that his belly is well adhered to the mother's belly. Chin pivots, little nose free, and he looks at his mom and falls in love. How wonderful. In this position, if you are in bed and have a space near you, you could fall asleep with the puppy at your breast. Watch out, because we have to have in mind what are the cares for a safe position. That is behind the puppy, there is space. We could use a pillow that gives support to this hand, which we will place behind his back, head free. And we have to imagine that if mom falls asleep, so she lets go, the baby doesn't move from there. So in this case, rooming in, bed sharing, and we also sleep together. Great relaxation time for the baby and his mom.